levels seem to be rising with newer generations. Young adults ages 18 to 33 reported having the highest average stress levels, and it was found that 39% of this generation experienced an increase in stress levels in just the past year alone, according to Alexandra Sifferland of Time Healthland on February 7, 2013. Stress and anxiety are both something that everyone experiences, so it can be beneficial to know the basics about them. When discussing stress and anxiety, it's important to know what they are, the causes and effects that they can have on a person, and what can be done to reduce and manage these feelings. To begin, stress and anxiety are closely related, but they are not the same thing. According to the Anxiety and Depression Association of America in 2014, stress is a response to a threat in a situation, while anxiety is a reaction to the stress. Stress and anxiety are common feelings to experience every day, perhaps when preparing for a test or trying to get ready in the morning. They can also be a major part of a psychological disorder. There are many different types of stress and anxiety disorders. Some of the most common types of disorders include obsessive-compulsive disorder, general anxiety disorder, panic disorder, post-traumatic stress disorder, and social anxiety disorder. According to the AADA, which was updated in September 2014, women are more commonly affected with general anxiety disorder, panic disorder, and post-traumatic stress disorder. The most common trigger of PTSD is rape. 65% of men and 46% of women who are raped will develop this disorder. Both men and women are equally likely to be affected by social anxiety disorder. These anxiety disorders are extremely common. According to Healthline's website, in 2015, 40 million Americans suffer from some form of an anxiety disorder. That is 18% of the population. This makes anxiety disorders the most common form of mental illness in the United States, according to the National Institute of Mental Health in 2015. Now, to look at what makes stress and anxiety so common. There are many different causes for stress and anxiety, as well as a variety of effects that these feelings can have on a person. Anything from figuring out what to eat to a major life change can cause stress or anxiety. Some common causes for these overwhelming feelings include moving, illness, injury, or death of a loved one, starting a new school or job, or changes in family. In all of these situations, it's not unusual to feel stressed or anxious. However, if you experience an excessive worry or anxiety about multiple issues that linger longer than 6 months or more, it can signal that you may have an anxiety disorder, according to an article on the New York Times website that was reviewed by Dr. Timothy Rogue in 2011. People can be predisposed to an anxiety disorder. There are multiple factors from which an anxiety disorder can develop. These include genetics, brain chemistry, personality, and life events, according to the Anxiety and Depression Association of America in 2014. Specific drugs and medications can affect a person's anxiety levels as well. Caffeine, cocaine, alcohol, and asthma inhalers are all known to make these feelings more extreme. There are both physical and behavioral effects to the feelings of stress and anxiety. Some of the physical effects include headaches, fatigue, nausea and vomiting, chest pain, muscle pains, shaking, and dizziness. The behavioral effects include over or under eating, angry outbursts, problems sleeping, drug and or alcohol abuse, and social withdrawal. Stress can also have long-term effects. Sheldon Cohen of Carnegie Mellon University stated that we know that stress contributes to poorer health practices, increased risk for disease, accelerated disease progression, and increased mortality. Depending on how a person's anxiety and stress levels affect them, there are different ways to manage the symptoms. An article on the New York Times website in June of 2011 suggests that certain lifestyle changes can reduce stress. Some of these changes include maintaining a well-balanced diet, getting a healthy amount of sleep, exercising regularly, and limiting caffeine and alcohol intake. It can also be extremely beneficial to make time for fun, along with work and other stressful responsibilities. Try to figure out what is causing the stress and anxiety as well. You can also try to talk to your friends and family about your feelings. Expressing thoughts can help relieve some of the tension on yourself. However, if a person's anxiety and stress levels don't seem to improve after a while, or if they are having a negative impact on their life, they should talk to a doctor or a counselor for more helpful treatment options. Today we have looked at what stress and anxiety are, the causes and effects that they can have on a person, and what can be done to reduce and manage these symptoms. Everyone experiences stress and anxiety during their lives. Whether worrying about an upcoming test or dealing with a major life crisis, understanding the facts about stress and anxiety can help a person improve their quality of life.